Our Dr. David Agus joins us now. Good morning. And Doctor, none of the White House recommendations are new. So what are the most important changes schools should make to safely reopen?
Thank you, Michelle. You know, it's difficult in that, at the CDC, you've got the pros. They're the best, epidemiologists in the world and public health experts. And we're relying on local experts, some of whom are remarkable, some of whom aren't, to make decisions. And so, what schools have to do now is they have to look in their area. What is the infection rate? Is it safe for me to open or not? And then what are my boundaries? If something changes, the rates go up, what do I do? If they go down, what do I do? And then what's the behavior in the school? Mandate wearing masks, social distancing, arrangements of classrooms. Who are the high-risk teachers? Who are the high-risk students? There's a lot of preparation that has to go in. All of this has to be done at the local level because there weren't federal guidelines on how to do this.
And we're seeing a lot of these last-minute turnarounds. Dr. A, I thought I was sending a freshman off to college this month. I found out this week his school's going virtual. I know you have a college-age student as both a doctor and a father. What would you like to see?
Well, you know what it's like. You feel horrible that your child is being deprived of in-person learning, right? I mean, the foundation of success is education, and we're changing education as we speak. And so what I want is schools to be transparent. Here are how we're going to open, and when this happens, we will do X or we will do Y. There needs to be true transparency. As a parent, for you to be comfortable with your child going to school is when the levels hit this, we are going to actually stop. Or we're going to quarantine when somebody's positive. And here's how we're going to do it. We saw a high school recently that quarantined 1,200 people after an infection after it was open. So real plans need to be made. And, it worries me. Many schools don't have contingency plans. They haven't established their boundaries. The federal guidelines now are generic. Know the symptoms of COVID-19 and then you can act appropriately. Well, that's not a guideline. That's a suggestion.
Well, you believe we need better federal guidelines, or guidance rather, not a state or local issue, keeping it at that level. Why is it so important?
Because these are data-driven. And every high school, every college, every elementary school needs to have the data to make the right decisions, and they need to know exactly what to do to keep safety. We're talking safety of children, of teachers, and of parents, because the children are going home and they could hug mom and dad or grandma or their next door neighbor. So it's not just the children that we're focused on. So these guidelines matter. This is the future of our country, are these children. And we have to figure out a way to educate them safely and do the best we have. Best practices are critical. We need to start to establish what is the best practice for an elementary school. How do we social distance? How do we get children to wear masks? What do we do when there's one case? What do we do when the number of cases go up? We need a book of guidelines for each of these schools on what to do. And what I'm afraid now is that really it is local by local. So you are trusting a county or a local health official to make a decision. In many cases, they're going to do exactly the right thing. But in other cases, they don't have the background or the experience to do the right thing.
Well, the president is saying he's ready to deploy the CDC teams to schools. Do you think that would be effective?
The CDC are remarkable epidemiologists and public health experts. We cannot deploy them to every school in the country. It's just not possible. What we need them to do is to make a playbook and schools to follow that playbook. If you're in a remote area in your university, you can create a bubble just like the NBA did and potentially educate your children. If you're at a high school in an area where the number of cases is going up dramatically, you may want to shut down a while till the number of cases goes down, else you're going to have to quarantine a good majority of the school. Without a playbook, I am really afraid of what's going to happen and that we're going to harm students. These are young kids. We're going to harm potentially parents and teachers. I honestly am worried.
Doctor, you've been on the ball about this for a long time, so we hope you're wrong about that. Dr. Agus, thank you so much.
Listen, I hope I'm wrong too.